As Dr. Fabiano mentioned, right, there are some meta-analyses and other cohort studies that have looked at this potential association between acetaminophen use and autism spectrum disorder, right? Similarly, one of the largest studies done that was published last year in JAMA looked at a population of over 1 million and actually, I think it was 2 million because it was in Sweden, and had a cohort of almost 200,000 children, and found no association, right, between acetaminophen use and but I think acetaminophen use, as you suggest, or paracetamol for any of our overseas listeners, right, is just part of the story here, right? Because and this is where association and causation are extraordinarily complex, and it is not as simple as one exposure is resulting in this problem, right? Because you mentioned something, and I do think it's really important for us to acknowledge the fact that we know that maternal fever in the first trimester can cause all sorts of bad things, actually. So there is well identified links and risk factors for neural tube defects, for heart defects, for facial oral clefts, for some other serious birth defects that are associated with fever in mom during that first trimester. And so, to suggest, well, sorry, moms, you just need to quote unquote tough it out, I think falls well short of the fact that we already have a very well established, not well understood, to be clear, right? Not well understood, but well established set of risks that fever, particularly high fever, in the first trimester mother is associated with things that are developmentally related.